Hello, this is your pre-lecture recording for Chapter 5 of the Claywell text. Chapter 5 is about using nursing theory to guide professional practice. So we're going to learn about a lot of different nursing theorists and what they had to say. So for a little background, theory guides how and why we do what we do every day as nurses. It guides the way that we provide patient care, and it guides the way we make decisions throughout our practice. I'm going to move that out of the way a little bit. So theory-based practice allows us to provide a systematic, knowledgeable approach to patient care, and it contributes to the professional growth of the nurse and the nursing profession as a whole. Nursing theory provides that systematic, knowledgeable approach, and it's a tool for us to use critical thinking and decision making in our nursing practice. It's kind of the way that all nurses can come to some reasonable conclusion about care for the same patient. Philosophies express beliefs about nursing and nursing related values. So I want you to think about a belief that you may have that would affect what you believe about healthcare or nursing. So maybe you believe in a higher power. So the way that you treat somebody who's going through the process of death and dying might be a little bit different than someone who didn't believe in a higher power. So the philosophy is the belief. There are three main nursing philosophers that we will study in this unit, and they are Nightingale, Watson, and Benner. Concepts. So, concepts are building blocks of nursing theory. They are based on philosophy. They might be abstract or concrete, but they must be clearly defined. So, constructs are similar to concepts, but they're more abstract. You won't be asked to define these things on any exams, so don't get too hung up if it feels very confusing, the differences between constructs, concepts, philosophies, theories. Just realize that a theory about nursing helps inform the way that we practice, and that philosophies are beliefs that we hold. A conceptual model or a nursing framework will guide the development of a study, and they help view phenomena related to nursing. So in this unit, we're going to look at the following theorists who developed conceptual models or nursing frameworks. We're going to look at Levine, Warham, King, Newman, Roy, and Johnson. Theories are an integrated set of concepts. So, what did we say concepts were? We said concepts were building blocks of nursing theory, and they could be abstract or concrete. They might classify a phenomena or interest. So, then theories are integrated set of concepts. Multiple concepts make up one theory. Um, and they can be used to explain, describe, predict, or control a phenomena. They may be developed using inductive or deductive reasoning. So, just in case you forget about the definitions of those, deductive reasoning would proceed from the general down to the specific, and inductive would proceed from the specific to the general. There are nursing theories that are very broad, and there are some that are very narrow, and there are some that are kind of in between. The kind of in between ones are called middle range nursing theories. And so, middle range nursing theories answer specific questions, they answer specific nursing practice questions. They describe phenomena and explain relationships, and they might predict the effects of one phenomena on another. They should be clear, simple, generalizable, important, and accessible. So, the middle range nursing theorists that we're going to learn about are Orlando, Pender, Leininger, Newman, and Parse. But don't worry about, again, like I said, you're not going to have to identify which theorists are middle range theorists. The test questions for this unit for this chapter, will be more focused on recognizing which theory belongs to which theorist, and different types of statements, which theory they would align with. I do want you to recognize that there are some theories that support nursing theories, but they are not nursing theories themselves. So there are developmental or physiological theories, such as Maslow's theory of the hierarchy of needs. And there's Erikson's theory of psychosocial development. You probably have read about those theories or worked with them in LVN school. Well, they're not necessarily nursing theories, but we do use them to support our practice. There's also something called systems theory, and systems theory basically says that all parts of a system are connected. So a change in one part is going to affect other parts of that system or other parts of that theory. There's role theory, and that helps nurses function therapeutically in interactions. Basically, it helps describe their role and the roles of people around them. So it helps us to understand how to behave in relationships and to understand the behavior of others. Adaptation theory helps nurses understand adaptation, basically. So, um, adaptation in a broader sense in science is when an organism or a living thing responds to a stimulus or something happening around it or to it. And so, adaptation theory kind of helps us. I need to begin again. Role theory helps nurses function therapeutically in interactions. It helps us to understand how to behave in relationships and also to understand the behaviors of others. What is our role? That's kind of what role theory is going to address. Adaptation theory helps nurses understand adjusting or adapting to stimuli. So when a person adjusts or adapts to something happening inside or outside of it, or something that is affecting it, that is going to help nurses inform their practice and how they respond. So there is the famous Florence Nightingale. I believe this picture on the left is the one that I'm most familiar with. I remember learning about her in nursing school myself. So Florence Nightingale is a nursing philosopher. She described the nurse's function as one that puts the patient in the best condition for nature or God to act on him or her. So she focused on the environment and concepts of light, cleanliness, ventilation, warmth, diet, and noise. And basically addressing those conditions, adjusting those conditions to put the patient in a good place to heal. There are three major relationships that Florence Nightingale focused on. That would be the relationship between the environment and the patient, the nurse to the environment, and the nurse to the patient. Next, we have Virginia Henderson. Here's a quote from her. It says, "The nurse is temporarily the consciousness of the unconscious, the love of life of the suicidal, the leg of the amputee, the eyes of the newly blind, a means of locomotion for the newborn, knowledge and confidence for the young mother, a voice for those too weak to speak," and so on. When you think about that and you imagine some of those scenarios, it's really very touching to think about what it is that we can do for our patients. So Virginia Henderson provided a definition of nursing, essentially that the nurse is to assist the individual, whether they are sick or whether they are well, in the performance of activities that contribute to their health or recovery, um, or even to a peaceful death. So Virginia Henderson is credited with integrating the view of holism into nursing, where we're not just physical bodies, but there's more to us than that as humans. She identified 14 needs that can be broadly categorized in terms of physical, psychological, emotional, sociological, spiritual, or developmental needs. And those are all in your book, so you can look them up there. Next, we have Jean Watson. Sometimes I like to see the pictures of nursing theorists because it reminds me that all of nursing theory isn't sometime in the distant past, that some of these nursing theorists are still alive today. Some have passed away just in recent years. So, really, they were informing nursing practice since I've been born. And that is a really neat thing to think about, that they have been contributing to nursing theory or philosophy, etc., during my lifetime. It's not like a dead science or something that isn't being studied any longer. It's not something that we should just ignore because it's done and over with, but that it's still very much a living science to study the science of nursing, especially considering how much the profession changes over time. So this is Jean Watson. She created the philosophy of science and caring. And she actually, I think she has an Institute of Caring that you can look it up on the internet right now. But that originated in 1979, and it was organized around 10 curative factors. So when you think of Jean Watson, associate her with caring. Um, she attempted to honor the human dimensions of nursing's work and the subjective experiences of the people that nurses serve. So, thinking about how our patients perceive and experience our care. She described the caring healing paradigm and also described that nurses themselves must be committed to self care. Next, we have Patricia Benner. And Patricia Benner is quoted as saying, "Leadership is showing respect, curiosity, and openness toward frontline workers." I feel like that might be a recent quote because of how popular the word frontline has been since the pandemic. Patricia Benner came up with the nursing philosophy of going from novice to expert. So when you start something new, you're considered a novice, and every nurse comes out of school as a novice. Even baccalaureate prepared nurses that have been in school for 4 years come out from nursing school as a novice. And so Patricia Benner focused on clinical nursing practice and her belief that nursing knowledge accrues or builds up over time. And so she has described 5 levels of skill acquisition. Obviously, the first is the novice. Um, Second one, advanced beginner. Third, competent. Fourth, proficient. And fifth, expert. So these are kind of like vocabulary words, and you might not be certain how to define them, or you might not have any way to look at a nurse and see how they practice and then determine which category they fall into. So I'll describe it a little bit now. Competence has to do with being able to apply or demonstrate a necessary skill. So when you start out as a novice, you may not even know where anything is on your unit. And as you go through your orientation, your nursing orientation, you're going to be gaining skills. And you're going to learn how to use the phones in your institution. Everything simple from phones all the way up to some very complicated life-saving equipment. And as you go along the way and you learn new skills, some of those will have to be demonstrated with competency forms where somebody watches you perform the skill and then signs off to say that you're competent. So competence just has to do with being able to apply or demonstrate a necessary skill. Proficiency, however, is being able to perform those skills with some level of mastery. So fewer attempts at being successful on some of those things. Um, Doing it well with few mistakes, being able to do it in a decent, time frame. And then experts are similar to people that are proficient, except that they can operate in a more holistic manner. And you might find that true from your experience as an LVN, that when you first got out of nursing school, things felt a little clunky, a little difficult. And as you got better at what you were doing, you could spend less brain power on ensuring that you perform a nursing skill properly. And you can take a step back and you're able to look at your patients a little bit more holistically and determine when they might have any social or emotional needs, and you might be able to meet those things as well. It's a being able to not only have skills but also be holistic about your practice. So that's going to be an expert nurse. So here's a quick practice question. A nurse is using a caring healing paradigm with 10 curative factors to plan nursing care. Which nurse developed this philosophy? 1. Patricia Benner. 2. Jean Watson. 3. Virginia Henderson. 4. Nola Pender. So the answer here is number 2. And there will be some test questions similar to this where it describes, what a nurse is using or how a nurse is practicing or thinking about something, and identifying which philosopher or theorist informed that nurse's thinking or practice. Next is Peplau, Hildegard Peplau. Hildegard Elizabeth Peplau. I love this. It's like an entry from her nursing school yearbook, and it says Pep, Hep, and so I'm guessing those are her nicknames. And it says she came from Reading, Pennsylvania, which is very close to where I grew up, so that's a little interesting. And look at this description. It says, she's just the editor-in-chief of the yearbook. A soapbox is all she needs to make her arguments forceful. So I really like that. And then here it shows the front of a book about Peplau. Calls her the psychiatric nurse of the century. That's exciting for her. So she's known as the mother of psychiatric nursing, and she created the theory of interpersonal relations in 1952. This theory states that nursing should be directed toward reducing dependence and encouraging autonomy. So, like one of our previous philosophers talked about how, we're the leg of the amputee and, sight for the blind, etc. This theory just says that while we do that, we are to be helping the patients move towards autonomy and becoming independent. So Peplau thought that the nurse, patient, health, and environment are interconnected and should be viewed within the context of the environment. Interpersonal relationship occurs in interlocking and overlapping phases. So you may have heard of this before, but there's pre-orientation, orientation, working, and termination. So these are like the phases of the nurse-patient relationship. And they are described in your textbook, and you should know those. Even though I'm not going over them right now, you should know those. There will most likely be a test question about which phase a nurse and patient are in based on the description of what they're doing. Next, we have Ida Jean Orlando, and she came up with the nursing process theory. The nursing process theory says that the goals of the nurse are to meet the immediate needs of the patient and relieve their distress or discomfort. nursing practice should be autonomous, basically, where we know what to do and we should be able to do those things without receiving direction or having to be told what to do. She believed nurses should explore the patient's thoughts, feelings, and perceptions, and also described how nursing assessment should include verbal and nonverbal cues. She believed that using the nursing process and the provision of nursing care provides an overall framework for nursing and is effective in achieving a good outcome. So, anytime you think about the nursing process, think about Ms. Orlando and her contribution. Next, we have Nola J. Pender. She created or described the health promotion model. So the health promotion model is based on the belief that the patient assumes an active role in managing their own health. And it's focused on wellness, and it clarifies the nurse's role in health promotion. So it focuses on 10 determinants of health promoting behavior. Let me get myself out of the way. So the 10 are prior related behavior, personal factors, perceived benefits to an action, perceived barriers to an action, perceived self-efficacy, activity-related affect, interpersonal influences, situational influences, commitment to a plan of action, and intermediate competing demands and preferences. So that's a lot of words, but I want you to think of a time when you saw someone or you yourself experienced a health issue, and think about the way that those 10 things affected your experience with that issue or with that illness. And you'll see why it makes sense that she described those 10 things. Next, we have Madeline Leininger, Transcultural Nursing. So Madeline Leininger describes the culture care theory of diversity and universality. The purpose was to provide culturally congruent nursing care in order to improve or offer a different kind of nursing care service to people of diverse or similar cultures. So we all have had to do this in the past, where you meet a person where they're at and you provide care to them with understanding of who they are, what they've experienced, what their culture believes. So she distinguished the term transcultural nursing, and she stated nurses need to realize that humans are complex beings who want their holistic views of life, care, culture, and health to remain together and do not want to be viewed as fragmented organs or body parts. And oftentimes I think that we understand this. Think about, the amputee. They don't want to just be seen as an amputee or somebody without a leg or half a leg. They want to be seen as a whole person. And similarly, people who maybe don't belong to the mainstream culture in your area or in your hospital, they don't want to be viewed just as an illness or a disease. They want to be viewed as the entire person that they are, and they want to be provided care that takes into account where they come from. Next, we have Margaret Newman, and she actually just passed away in 2018. There she is at the American Academy of Nursing speaking. Margaret Newman developed the theory of health as expanding consciousness. This focuses on patterns, life processes, and wholeness. Life process is a progression toward higher levels of consciousness and health, and Newman believed that health and evolving pattern of consciousness are the same thing. So interactions that occur between the environment and the person are key processes. If you'll notice, I've mentioned that multiple times about multiple theories, that the environment is important to health and healing. Margaret Newman believed that both health and illness can be seen as the manifestation of the pattern of the person environment. And so all of this sounds very kind of like lofty, and it might be difficult to understand what exactly she means by this. So here's a little thing that might help. Nurses need to listen to the rhythm of another person's interactive pattern, whether it's irregular, difficult to sense, or chaotic. Nurses need to hang in there with clients or patients until a new rhythm emerges. I definitely don't think about people or nurses this way, but when I read about it, it does resonate with some life experiences that I've had or some work experiences that I've had. So I do kind of understand where she's coming from. It might not be my favorite theory, but I do recognize its value. This is Dorothy Johnson, and she came up with the behavioral systems model. So this focuses on human behavior. It states that the goals of nursing are to assess the internal and external environments and help the patient select mutual goals and develop interventions. Think about the nursing process. We definitely include that when we come up with SMART goals. We come up with things that our patients will agree with as far as goals. Persons are composed of 7 interrelated behavioral components or subsystems that function together to form a whole. And so these 7 components are attachment, dependency, ingestive, eliminative, sexual, aggressive, and achievement behaviors. This is Imogene King, and she came up with the theory of goal attainment. Imogene believed that humans are composed of 3 interacting systems: personal, interpersonal, and social. She believes that the human beings, our patients, the people we're treating, are the focus of nursing care. King said that the theory of goal attainment provides a process for human interactions that lead to transactions and to goal attainment for individuals, families, and communities. The structure is human beings transacting with their environment. So the goal of the theory of goal attainment, the goal to be attained would be health for individuals, groups, society, and even the world. Who doesn't want to hear from a lady that wants to make the world healthy? Next, we have Myra Levine, and she came up with the conservation model. So the conservation model is based on 3 concepts: wholeness, adaptation, and conservation. Conservation occurs in 4 areas. There's energy, structural integrity, personal integrity, and social integrity. The health or well-being, which we could also call the wholeness of a person, is sustained through adaptation, a process of change in which conservation is the outcome. So, wanting to conserve what we've got. Next, we have Betty Newman, and she came up with the healthcare systems model. Betty says a person is a complex system who responds to stressors originating both internally and externally, and it guides practice at 3 levels of prevention. And if you haven't learned about the 3 levels of prevention, you will at some point in your ADN education, but I feel like you probably have learned about it in LVN school. So there's primary prevention, secondary prevention, and tertiary prevention. So Betty Newman believes that nurses should treat the whole person, whereas systems like individuals, groups, families, and communities are seen as being constant change or motion, and interventions are going to be aimed at maintaining stability. So the healthcare systems model. Here's Dorothea Orem, and she came up with the self-care deficit theory. The theory of self-care deficit is composed of three other theories: nursing systems, self-care deficit, and self-care. She says the outcome of all nursing actions should be to promote self-care in all individuals. She defines activities as self-care as purposeful, ordered, and learned. Self-care agency is described as the degree to which a person is able to participate in this. An infant may be less able to participate in their self-care than maybe a 30-year-old. Self-care deficit is the degree to which the patient is unable to perform self-care. And then appropriate care should be developed through three operations: diagnostic, prescriptive, and regulatory. So ORM, theory of self-care deficit. This would be Sister Callista Roy, and she came up with Roy's adaptation model. So this is based on adaptation and adaptive behaviors that are produced by altering the environment. The goal is to promote adaptive responses through a 6-step nursing process: assessing behaviors, assessing stimuli, formulating a nursing diagnosis, setting goals that promote adaptation, implementing those interventions, and evaluating whether the goals have been met. Sounds familiar, doesn't it? So the person, she says, is a biopsychosocial adaptive system with physiologic, self-concept, role function, and interdependent modes. Let's look at our next nursing practice question, or nursing models practice question. So this says, a nurse wants to use Imogene King's model to plan nursing care. Which principle should the nurse remember? The interpersonal relationship occurs in phases known as pre-orientation, orientation, working, and termination. Number 2, nursing practice will be guided towards 3 levels of prevention: primary, secondary, and tertiary. Number 3, human beings are the focus of nursing care, and the goal is health for individuals, families, communities, and the world. And number 4, conservation is guided in 4 areas: energy, structural integrity, personal integrity, and social integrity. So this is another similar question to a couple of questions that you might see on your exam. The answer, if you don't remember, is answer number 3. Human beings are the focus of nursing care, and the goal is health for individuals, families, communities, and the world. So as you go through ADN school, it's going to be up to you to choose the nursing theory that's most in line with your beliefs and appropriate to your practice. This provides the rationales for why you do what you do, and it serves to guide nursing practice. When you develop your own personal philosophy of nursing, it's going to require you to take a close look at your own beliefs, and professional practice is going to reveal your growth as a nurse. In 10 years, you'll be able to look back and see how you've grown. If you have any questions, please feel free to contact me. My email is jrgenn@actx.edu, or you can send me a message through through Blackboard, and my contact information is on Blackboard as well. Please don't forget to read your chapter, and for this content, you might want to look at making flashcards or some way to help you be able to memorize associations between the philosopher and their philosophy, or the theorist and their theory. Okay?